It's my pleasure to go ahead and introduce Suzanne Gordon. She is an award-winning journalist and author who writes about healthcare delivery, healthcare systems, patient safety, and nursing. She's the co-founder of and is the Senior Policy Analyst at the Veterans Healthcare Policy Institute. She's written over 20 books, including recent books such as Wounds of War, How the VA Delivers Health, Healing, and Hope to the Nation's Veterans, and the book, The Battle for Veterans Healthcare, Dispatches from the Front Lines of Policymaking and Patient Care. Her most recent book, called Our Veterans, Winners, Losers, Friends, and Enemies on the New Terrain of Veterans Affairs, was very favorably reviewed by the New York Times. She has received the Disabled American Veterans Special Recognition Award for her work covering veterans healthcare. I'll also note that most of her earlier books, I believe, were regarding the nursing profession. She has been a radio commentator for CBS Radio and National Public Radio's Marketplace, and her articles have appeared in publications ranging from Harper's, The Atlantic, The New York Times, and The Los Angeles Times, to JAMA, the Annals of Internal Medicine, the British Medical Journal, and many others. She lives in San Francisco area with her husband. Ma'am, I'm going to say, I know we've got a limited amount of time where we're leaving at 1:15. And at that time, I actually have to leave myself to go have an appointment at a VA hospital, as I've served 21 years in the Air Force. So I'm very much looking forward to this. Thank you for coming here with us, and the floor is yours.
Great. Well, Chris and I started writing about VA healthcare. I started working with the VA as a consultant in about 2007, I think it was, and really didn't know much about the system then, and you know, just kind of didn't appreciate how amazing it is and how comprehensive it is and how it serves all of us. I mean, I don't know if Don got to this, but, you know, the VA clearly takes care of veterans, but it also teaches 70% of American physicians in training, has 50% of internships for people who are going into psychology, practically invented geriatrics, and it really is the hub of our professional healthcare training teaching system, which is why many of you will probably pass through the VA as you go through medical school or internship. The VA is also second to the National Institutes of Health, the biggest research powerhouse in the country. Anyone who has an implantable cardiac pacemaker has to thank the VA, the nicotine patch, the first shingles vaccine, understanding COVID, understanding prostate cancer, et cetera. And then the other thing the VHA does is it has a memorandum of understanding with the Department of Defense and serves as a backup to the military healthcare system in times of war and terrorism, and also serves as a backup to the civilian sector system in times of national, regional, or local emergencies. Like in Hurricane Maria, the VA hospital in Puerto Rico was the only functioning hospital on the island and served all Puerto Ricans. So I think it's a real mistake to think of the VA as a veteran-only healthcare system, as a healthcare system that serves only veterans, because it really serves us all. And of course, in serving veterans, it serves us all, because no matter what you think of American foreign military policy, and I don't really think a lot, I'm very critical of it, people sign up to defend the nation or serve the nation, and we have to provide them with healthcare if they get into trouble in the military. And, Chris can maybe talk more about this, but veterans have and I don't know if Don talked about it. Did Don talk about the fact that veterans have very specific healthcare problems? He did. Okay, so I won't go over it. I mean, they have very different healthcare problems than non-veteran patients. And you have to have a population health system that treats those very specific problems. I mean, you have to think of the veterans healthcare system like you think of a pediatric hospital or an oncology hospital or an orthopedic dedicated hospital. You have to understand these problems. And as you go through medical school, you'll see that probably very little mentioned about veterans' healthcare problems in your curriculum, because veterans, are now 1%. No, veterans are about 7% of the American population. Active duty service members are about 1%. So, it doesn't really make sense to spend a lot of time when you're going into medical school to teach you about veterans' healthcare problems. The only place that you would learn about that is in a place that just takes care of all veterans. And so I really view the VA, and I don't know how much Don talked about this. I view the VA as a model for the kind of healthcare system everybody should enjoy in this country. We shouldn't have the only model of comprehensive healthcare. And when I say healthcare, I distinguish healthcare from disease treatment. We have in America, I would argue, a broken, dysfunctional disease treatment system. We don't have a healthcare system, right? They talk about healthcare. It's very hard as a journalist when you talk about the broader healthcare system, because I don't think we have a broader healthcare system. We don't have a system. It's not healthy. Walter Cronkite, who you probably never heard of, maybe, was a very famous journalist and TV news anchor. And in the 90s somewhere, he once said, the American healthcare system is neither healthy, caring, or even a system. And so it's hard for me when I talk about healthcare, the VA healthcare system. The VA is a healthcare system. And then I talked about the broader American healthcare array system. And it's not a system, and it's not about health, and it's certainly not about care. It's about profit and profiting from episodic, fragmented treatment of diseases, really, or kind of dysfunction. And I think it's really important to understand healthcare, includes social determinants of health, not just, treat. I mean, disease treatment is a very important part of a healthcare system, right? But it's not all. And an effective treatment of disease requires comprehensive integrated care. I don't know if Don talked to you much about the details, because this, I think, is pretty important of VA healthcare. But, for example, they integrate in primary care clinics mental health and primary care. So did he talk about this much? So if you go to your primary care provider in a VA clinic, primary care clinic, and you say, I'm depressed, or I'm anxious, they don't do what most doctors do or nurse practitioners do in the private sector, which is give you a referral, if your healthcare system covers it, to a mental health provider, and hope that you call and make the appointment. And if you make the appointment, which is a big if, hope that you go to the appointment. In the VA, they walk you down the hall. It's called a warm handoff. And your doctor or nurse practitioner will introduce you to a psychiatric nurse practitioner or a psychologist on the spot. And you will talk to that person there, and then they will ascertain your needs and maybe deal with them there. This is really important because you'll see, and they also have dietitians and pharmacists in the clinic, and social workers. This is like super important, because not only does it support the primary care provider, but it assures that the patient is going to get services. Because if you you've all talked to your friends, I'm sure you've had a friend who might need, mental health help. And it's really tough to get somebody to say yes. And then it's really tough to get somebody to do it. And if you have it on the spot, and also they give each other advice, like that. You're going to be I think almost all of you, Don told me, are going to be physicians, except a couple of you maybe aren't. But if you're going to be a physician, one of the biggest problems in American medicine is that doctors practice solo. And particularly if you're going to go into primary care, and we desperately need you to go into primary care, the solution to burnout as primary care is teamwork. It's having a social worker you can talk to, a dietitian you can talk to, a nutritionist you can talk to, a pharmacist you can talk to, a psychologist you can talk to about your patients. And I don't mean, send notes in the chart. I mean, talk to about the patient, right? Because that conversation is not only helps the patient, but it supports you. It surrounds you with a community of support. And that's really critical. And the VA, I would argue, is the only system in America that is an actual healthcare system. They do disease, they deal with diseases, they deal with mental health conditions, but they also deal with homelessness. They deal with socioeconomic problems. They deal with social isolation. I mean, you walk into a VHA clinic and you see people actually talking to each other in a waiting room, right? I mean, I've been in a lot of waiting rooms in my 78 years as a human being in America. I have never seen people talking to each other. I mean, for the women in the group, well, maybe you're too young to get this, but even in a place where you all have sort of something in common, which is the mammogram, getting a mammogram. You're all sitting there, you all have tits. You're all sitting there waiting to get a mammogram. You're all terrified of what the mammogram is going to find. And nobody talks to each other, right? You sit there in your little bubble of terror, right? And anxiety. Nobody talks to each other. In the VA, they're talking to each other all the time, right? And that community is very important for patients, and the providers also talk to each other. So you have an integrated healthcare system that deals with healthcare, social determinants of health. Do people have good food to eat? Do they know how to read a label? Do they know how to cook? I once attended a salsa dancing class in the VA, and I once talked to a Republican who said, "What do you mean they're doing salsa dancing? And that's not healthcare." And I'm like, yeah, actually, if you're a Iraq vet who's terrified of people, salsa dancing is like super important. And besides, it's really fun, So and this is like a comprehensive system. It works. Every single study that we have, and there aren't a lot of studies of salsa dancing, although it would kind of be interesting to have one. But every single study that we have practically shows that the VA's model of comprehensive healthcare is superior to the private sector. I don't know if Don mentioned, there was a very famous study that came out about 2 years ago, 500,000 emergency ambulance ride visits for veterans who were what's called dual eligible. They had Medicare, which made them eligible for private sector care, and VA care. And they were taken randomly by these ambulances to either a VA or a private sector hospital ER. It was staggering, the results. The vets who went to private sector ERs were twice as likely to die in the first 28 days than if they went to a VA emergency room. Think about that. Why do you think that might be? What was the variable that you think? I'm gonna throw it up to you. Why were you twice as likely to die in a private sector ER? And by the way, and the cost of your visit would be 21% higher than at a VA. What do you think was the kind of secret sauce here? Anybody have an idea? I can't see all of your hands, I'm sorry. Just shout it out if you have an idea.
Go ahead, Chris.
No,
Go ahead.
I was just jumping in. I'll jump in then real quick. I used to actually drive, people as an EMT, to different emergency rooms. And I will say the two things that stood out was, one, if the people are treated differently, honestly, it's just, there is more of they would call them by their name or their rank or whatever. There is a community there. The second thing I will say is, and I don't know how this applies, but it wasn't as overwhelmed. And I don't know that that's necessarily.
Yeah, well, I'm absolutely true. You're probably not boarding patients for 3 days in the corridor in a VA emergency room, but the secret sauce here was coordination. and follow-up. I mean, when a VA patient goes into an emergency room, they are immediately followed up by a nurse, finding out what's going on, and then assuring they get needed follow-up care, and then they're talk to physicians or nurse practitioners or whatever. So there's a big coordination and integration of care, and that makes the difference. And that just doesn't happen in the private sector. I mean, we are our care coordinators in the private sector. It's kind of scary, and even if you're a nurse or a doctor, when you're a patient, it's kind of hard to coordinate your own care. So there's just a font of information out there about the superiority of VA care. And it's because it's superior. It's because it competes and wins with the private sector that these hard right ideologues want to privatize it. There's a very important book that was written like in 1982, this Paul Starr's The Social Transformation of American Medicine. And he says, he talks about the competition between public health. And the VA is, by the way, a public health system. It's a health system based on public health principles. So population health, social determinants of health, and so forth. And he said that, medicine has always competed with public health because they saw public health. The minute people in public health wanted to start treating patients, right, as opposed for free or for very little, and competing with doctors' incomes, they started to dismantle it and attack it. And the Starr says that, there's a cardinal principle in America is that the public sector should never compete with the private sector. And if it competes, it has to be a rigged competition where you assure that the public sector loses, right? So you defund it, you trash its reputation, and so forth. And that's what we're seeing now. The VA competes with the private sector and it wins. It's won the Super Bowl. It's won the World Cup. It's won, the World Series. And yet the Republicans and the hard right ideologues and the medical industry wants to, because it wins, it wants it to go away because we're not allowed to have a government-run system that works. And we have one that works. And so what has happened over the past 10 years is that a series of legislative initiatives have passed that have channeled veterans outside of the veterans healthcare system into the private sector. And one critical piece of legislation I think Don may have mentioned was the Mission Act of 2018, which set up a parallel private sector healthcare system that the taxpayer pays for and that veterans can access if they have it for a couple of reasons. If they have to wait more than 20 days for a primary care or mental health appointment and drive more than 30 minutes, or if they have to wait more than 28 days for a specialty appointment and drive more than 60 minutes. And since 2018, and it's called the Veterans Community Care Program, they set up this parallel healthcare system that's essentially an insurance. The VA has become an insurance payer for private sector care. And then they're also supposed to simultaneously run a in-house comprehensive healthcare system where they are the payer and provider of care. Now, I think of it, there's no healthcare system in the world where if you go out of network, it's paid for. There's no how Kaiser, if Kaiser would go bankrupt in like 10 minutes, if it said to all its, enrollees or subscribers, whatever you want to call them, you can go to, UCSF or Sutter, this is in California, or wherever you want, it will pay for you. In fact, in Kaiser, you can't even become a member of Kaiser if you live in a place where there's no easily accessible Kaiser facility, because they're not going to pay for you to go somewhere else. Or think of it kind of like a hotel chain, where, I mean, the Veterans Community Care Program is essentially like, if you have to drive more than 30 minutes or more than 60 minutes, you can get your care paid for to go to these private sector providers who, by the way, aren't required to see you in the same amount of time or even required to know anything about veterans' special healthcare conditions. So they don't know about combat-related PTSD, military sexual trauma, how to distinguish a cough from, burn pit related bronchiolitis or anything like that. They're not required to take these extensive trainings that VHA providers are required to take. They don't know how to recognize a suicidal veteran. Every VHA employee has at least an hour of suicide prevention training, and then if they take care of patients or are psychologists or something, it's very extensive. So, for example, a dentist in the VA, if he sees a patient and he says, "I need to see you next month," and the veteran says, "Well, I'm not sure I'm going to be here next month," and he gets the feeling that the veteran is saying, "I'm not sure I'm going to be on this earth next month," he will initiate a whole series of actions to try to prevent that veteran's suicide. I mean, many times a veteran can go to a private sector provider, or even in the Veteran Community Care Program. They don't even know they're a veteran. The billing department might know they're a veteran, but the provider may not. And, nobody asks patients if they've served in the military. That is not a standard question on a patient history. I've been a patient for 78 years. Obviously, when I was a kid, nobody would have asked me, but I could have been a nurse in Vietnam. Nobody's ever asked me if I've been in the military. Nobody's ever asked my husband if he's in the military. It's kind of an important question. But again, why should you take time to ask that question if so few of your patients are veterans? So they've created this parallel system. They're sending patients out, and they're using VHA clinical care budget. The private sector now takes 30% or more of the VA's clinical budget, over 6 million patients, over 1.7 million providers in this network. And you can't run two parallel systems at the same time, right? I mean, it's kind of like you have to pay the same fixed costs for your facilities and improvements for them and renovations. You have to pay the same labor costs, and yet you have no idea how many patients you're going to have or how many dollars you're going to have. How do you run a healthcare system that way? And the reality is, what's happened is that there's now a $4 to $5 billion deficit in the VA. They're cutting staff, they're cutting services, and this is very deliberate. The Mission Act was crafted by apparatchiks of the Concerned Veterans for America, which is the Koch-funded, dark money-funded, anti-VA, supposed veteran service organization. The people who wrote the bill were representatives of CVA in the White House. Trump, loves privatization. He accuses all VA employees of being sadists and so forth and trying to kill veterans in his inimical way, just like, all Mexicans are whatever. He, black and white guy, right? And so he, in the horrible debate that happened last night, he was very proud of privatizing the VA. And if he gets in, Chris will no longer have a VA to go to, because they'll just completely kill it. And you have, we had a report that came out recently in April. It's called the Red Team Report, and I can put a link in if I can. I have a very hard time talking and linking at the same time, but the Red Team Report was was commissioned by the VA to assess what's going on with the Veterans Community Care Program, and it showed that 30% of the community care dollars, which amounts to something like 36 billion a year, is going to pay for veterans to go into ERs that we know deliver sometimes lethal care. 5%, I think, or 8%, I can't remember the exact figures, were going to pay for private sector oncologists, where we know that they prescribe unnecessary treatments. Like unnecessary studies have shown that if you go to a private sector oncologist for clinically insignificant prostate cancer, if you're a man, you're more likely to be given a radical prostatectomy or invasive radiation treatment, or get chemo drugs that the oncologists are allowed to mark up by 116 to 600%. And in a fee-for-service system, you can always justify, oh, well, your clinically insignificant cancer could turn into clinically significant cancer. So let's be careful, Joe or Juan or whoever, and give you this radical prostatectomy, which could, significantly impact your life and even kill you, right? I mean, giving people treatments that they don't need is a fundamental violation of medical ethics and patient safety, right? You do not want to give people treatments they do not need, because as you will learn, anything, there's no free lunch in medicine, and anything could have side effects that will be very bad for you, if not lethal. 8%, or again, it's either 5 or 8% of VCCP dollars go to sending people to private orthopedics, who are more likely to give you an unnecessary knee, hip, or shoulder replacement. And 5% is going to mental health providers who don't know anything about veteran-specific mental health conditions. The Red Team report recommended 30 different things, but 6 of those things were bringing people back to the VA for ER care, oncology care, mental health care, orthopedic care, and also bringing more telehealth back to the VA, which was and is the global leader in telehealth. VA now has a $5 billion or $4 to $5 billion annual deficit. Just implementing 5 of the 30 recommendations would save $23 billion a year. But Congress is not willing to do this because they want to privatize the VA. So, I really want to, I'm sorry, I probably have talked too long. I want to give a few minutes for questions, but anybody who cares about healthcare in America should care about this. Anybody who cares about healthcare in America should know about the gem of a socialized medicine system that we have. And if they want healthcare for all, which I should hope all of you want, we should care about expanding the VA, not only to all veterans, but to veterans communities, and viewing the VA as a model of care for all of us. It's a national gem. The kind of teamwork that they have in the VA when it's well-funded and well-staffed is a solution to burnout, which is a very huge problem in American medicine. And so I really think it would be great if you all would learn more about the VA. I would love for you to subscribe to the newsletter of the Veterans Healthcare Policy Institute. Again, I'm going to have to put this in the chat. And why don't we have a few questions, because I'd love to answer your questions. And Chris, can you call on them, because I'm trying to look up some stuff that I can put in the chat for folks.
Absolutely.
And I'm going to do that right now, everyone. Okay. Okay, go for it. questions, comments? I'll feel like a failure if you don't ask me a lot of questions. We have exactly 7 minutes.
I'll start off with a question. I could ask a ton of questions, but I'll start off with a question. What's the number one thing we can do now with regards to both protecting the good parts of the VA care that you're emphasizing right now, as well as potentially advocating for its expansion into the rest of the
Yeah, I mean, well, the first and most important thing is to know about it, to understand the system, because people don't understand what the VA does. And they, they don't read my articles of the American Prospect. They listen to, CNN or Fox News, God forbid. So the most important thing, I mean, I would suggest, like checking out the Veterans Healthcare Policy website, subscribing to the newsletter. It's free, and just understanding this healthcare system and how it works. I mean, obviously, if you wanted to read my book, Wounds of War, I'd be thrilled. But and so that's number one. And if you hear people saying things about the VA that are negative, talk about how good the care is. I mean, it's just, there's all these fact sheets on the website. I can put that in the chat. And then, write to your congressperson, write to your senator, call them up. I mean, it's very simple. Hello, don't privatize the VA. Stop outsourcing care to the VA. If obviously, we have a disastrous situation facing us in the presidential elections. I don't even know what to say. If Biden doesn't step down, we might as well just not even have an election, in my view. And maybe I shouldn't be saying this on this, but it was terrifying watching that debate last night. I couldn't watch it all. And, I don't think it's an age thing. I mean, I'm 78. I'm 3 years younger than Joe Biden. I come off, I'm pretty old, I don't dye my hair. It's natural, but you're 78, you can't, I don't know. He's not Bernie Sanders and he's not me. And so it's not an age thing. It's a health condition thing. And the guy is not doing well, but we need somebody in there who can win and who can take this guy on. And I think, I don't know, I don't know how you get young people to vote for Biden, given Biden's performance. I don't know how you get people to do that. That's a whole other talk. But I think that basically the most important thing is to learn about this healthcare system. That is the only healthcare system in our nation. And try to, there's, if you look on VHPI website and you look under our work and reports, we have a whole little very small pamphlet that tells you how the VA works. And, you don't have to immerse yourself into it as much as I do, but, you're going to probably go through a VA. And so it would be good to know what it is that you're in, so that's, I think, the most important thing. But I'm going to call on somebody if you guys don't raise your hand. So
I can go. So this is a common probably misconception, but I feel like I'll just ask this. But one of the complaints against the VA is long wait times. I wonder how you respond to that. What's the best way to respond to that?
Absolutely. Well, and thank you so much for asking that question. There are obviously wait times in the VA. They are shorter than the private sector. The private sector doesn't even collect wait time data. There's a company called Merritt Hawkins that every 2 years compiles wait time data in 15 different markets for a short list of subspecialties. And the wait times are all way longer than the VA. This idea that there's long wait times is a product of a very concerted effort to tarnish the VA. And also the wait times that they establish in the Mission Act are unworkable. There is no system in America know you can't get a dermatology appointment in America in 28 days. My husband tried to get a pulmonology appointment for a serious respiratory problem. 4 months, it was 4 months out. A week before the appointment, he was told that the pulmonologist left and he'd have to wait another 5 months. So there are wait times, VA, but they are shorter than private sector. In rural health, everybody has wait times because there simply is no care in most rural areas for complicated reasons. So this is a bogus issue that has been created to tarnish the VA. Are there problems in the VA? Do they make errors? Do they have some long wait times in some places? Yes, but the solution to that problem is not to close the system. It's to create more primary care providers, more mental health providers in the American healthcare system, and also to staff up and give more money for staffing. I think we have 1 more minute. Do we have one more question that I can answer in 30 seconds? What's another misconception about the VA?
I'll say it real quickly. That a lot of veterans complain about the VA, but they don't complain about, and it's not a misconception. They do complain about the VA, but they don't complain about their VA. It's always the others. I've got a lot of veteran friends. Everybody loves their VA.
Yeah, and that's because they listen to Fox News or something, and it's like, well, they hear all this terrible stuff, and it can't be my VA. I mean, I couldn't agree with you more, Chris. And I would love it if you would send me an email, because I would just love to talk to you afterwards as a veteran. But I sat in Milwaukee in a room full of vets in a PTSD program, and they all loved their VA, but they were certain that the VA, 100 miles away was terrible because they heard it on Fox News. And I'm sure that the folks in the VA 100 miles away thought their VA was wonderful, and they thought that the Milwaukee VA was terrible. Also, I can want to end on this, that many veterans, when they complain about the VA, aren't complaining about the Veterans Health Administration, the VHA. They're complaining about the Benefits Administration, and that's a whole other complaint, right? So when you talk to vets about the VA, I learned very early on in my work with veterans that you have to find out which part of the VA. The VA runs the Veterans Benefits Administration, which is the largest benefits enterprise in America. Home loans, GI Bill, et cetera, benefits, compensation, and the cemeteries. And many times they would complain about the VA, and it was the VBA. But of course there are things that go, I mean, how can there not be things that go wrong at the VHA, right? It's the biggest healthcare system in the country, one of the biggest in the world, and it's a human system, right? And I don't know a single human system that doesn't have problems. So, but also, Chris, I think you maybe would agree that, many of veterans who complain about the VA, I mean, they complain about it because they have this grass is greener thing, and they haven't experienced the joys of the private sector healthcare system, right? They don't know what. I mean, you want something to complain about, have fun.
Very much so. Veterans do like to complain at times. Yeah, it's a bit ironic sometimes. Can I get your email address? I actually have to go to that appointment.
So I'm going to give you all my email address. It's SG, like Suzanne Gordon, SG@SuzanneGordon.com. And Chris, what's yours?
It's tough. It's Chris, CHRIS .Leavey, LEAV as in Victor, EY @gmail.com.
Okay, Chris.LEAVEY @gmail.com.
Yeah.
And anybody on this Zoom should feel free to email me at SG@SuzanneGordon.com if you have other questions. And I'm sorry it was so short, and I'm sorry I wasn't there. If you want me to come back or you want me to answer any questions, just send them to me. It's really exciting. I'm so happy. This is, I think, the third year or something like that, that we've done this. And I wish you all really well in your journey through wherever you're going. Take care.
Thank you so much.
Thank you.
Thank you very much.
Thanks so much.